is Dr. Naziru Rashid, and you're going to talk about hepatitis B. Some of you have got your family members, friends, lovers suffering from that disease, but you don't know the causes, the symptoms, and you get to know the problem when it's too late. So, if you're at Islamic University in Uganda Females Campus page, you are here to understand and to learn more about it. You're welcome, Dr. Rashid.
Thank you very much.
Actually, I didn't explain to people the position you hold because I knew you were going to talk about it.
Oh, thank you very much. I'm glad to be here once again with Mr. Balgaya Afan.
Yes, sir.
And I'm glad to be here again at our mighty Females Campus. As I've been introduced, my name is Dr. Naziru Rashid. Currently, I serve as the University Medical Officer at the Islamic University in Uganda. We have a number of health facilities, both in Kampala and in Mbale. We have one at the Females Campus. We have Ayu Medical Center, King Fahad Plaza, and Ayu Health Center at our main campus in Mbale.
King Fahad Plaza started working?
Yes.
For only members of Ayu or for the whole community?
All our facilities, they serve both the Ayu community and the Uganda and international community.
MashaAllah.
You can even refer patients from South Africa to come and get the best medication from our facilities.
Thank you so much for that information. Now, many people don't know about hepatitis B. As a doctor, what is the hepatitis B?
Oh, thank you very much. I know our people are now washed with a lot of information concerning coronavirus disease of 2019, or call it COVID-19, and we have somewhere neglected other diseases which are actually also still killing people in magnitude and in large numbers. In our previous video, we talked about non-communicable diseases. So today, we're going to talk about one of the communicable diseases called hepatitis B, which is also killing a very good number of people. It's also one of the leading causes of hepatocellular carcinoma, which is cancer of the liver. Yes.
Hepatocellular carcinoma.
Hepatocellular carcinoma, yes. That is cancer of the liver. Yes, so hepatitis B is one of the leading causes of that type of cancer.
Okay.
It is consuming many people, both in developing and developed countries, as we're going to see the statistics.
Okay. So, hepatitis B does not only end to be hepatitis B, it has some other issues that is caused, it is a secondary part, just like you said, hepatocellular carcinoma.
Yes.
Is it a secondary part or?
Hepatocellular carcinoma, we shall reach there, but it is one of the effects of hepatitis B.
Okay.
But hepatitis B is independent on its own.
Okay.
Yes, as studies have shown that globally, currently, there are about 350 million people.
Million people?
Yes.
That is the magnitude?
Yes, that are currently suffering with the hepatitis B. And when you look at local statistics, most of those are from the developing countries that are still developing, but does not spare the developed countries. They're also affected the same way. Recent studies that have been done, that was around 2015, 2016 in Uganda, they showed the national prevalence of 10% of hepatitis B.
Oh,
that 10% is a big number because our population is around 42 million.
42 million.
It's estimated to be around there. So 10% of that is actually a very big number. However, that figure varies from region to region, from 4% in southwestern Uganda, around 25% within the northern and the northeastern parts of Uganda. Meaning that people in those areas are more affected than people in other regions of Uganda. Other studies were done still in northern Uganda. They showed, they tried to test pregnant mothers and the figures showed around 10% of the mothers that were tested positive for that virus. So that's how big the infection is, but little is known about it, especially in our general community.
Okay.
And that's the basis of as to why we came up to come and share this kind of information with our people.
Okay, Doctor, knowing about the percentage from different regions and the variation of those percentages, then that takes me to causes. We would like to know what causes this hepatitis B so that we get to know why the percentage is higher than from in west or southwestern region than the east, or according to the variation.
Okay, thank you very much. Like we said in our previous video, we categorized our diseases into two.
Yeah.
The communicable and uncommunicable. So as I said today, we are looking at one of the examples of communicable diseases, which is a disease that can be spread from one person to another, but also has a factor or an agent that causes it.
Yes.
So hepatitis in general means inflammation of the liver or damage to the liver. So the word hepatitis, yes, the word hepatitis means inflammation to the liver, and that one has several causes, including infections or infectious causes and non-infectious causes, like injury, like overconsumption of alcohol. Those are non-infectious causes. So the infectious causes also includes the bacteria, the viruses, the parasites, to mention but a few.
Yeah.
So hepatitis B in particular is caused by a virus called hepatitis B virus. Is what causes this type of inflammation to the liver, and it is spread in a number of ways.
Yes.
As we are going to see, its mode of transmission of that particular virus, like I know our community now is mostly aware about the number of viruses or viral diseases or viral infections, just because we have prominent diseases.
The sounding diseases.
Yes, like HIV, for
HIV, COVID-19.
which is caused by virus, the coronavirus disease is also caused by virus. So this hepatitis B is also caused by a particular virus called hepatitis B virus, just like those other two viruses,
yes,
diseases. And as our community has now learned that most of those diseases, they may seemingly be simple to manage, but very difficult, most of those viral diseases. So the mode of spread of this particular one, the hepatitis B virus, is somehow similar to the mode of spread of HIV virus. It is spread through contact of blood and body fluids between an infected person and a non-infected person. So if your blood comes into contact with the person who has the virus, so you're most likely to get that virus or other body fluids.
Even during sexual intercourse.
Yes, so as our viewers already know the mode of spread of HIV/AIDS, I'm just going to run through. So the same as hepatitis B virus can be got through sexual intercourse, that is one, and be got through blood transfusion if that blood is infected, and be got through sharing of sharp and piercing objects, can be got through sharing of needles, especially to the groups of people who are using injection for drug administration. The drug addicts, those people who abuse drugs using injections, they are also a high-risk group of contracting hepatitis B virus disease. Another very high-risk group is me or us, the health workers. Because of our nature of work, the health workers, the doctors, the nurses, the radiographers, the pharmacists, and also the medical and nursing students are also another high-risk group to contract hepatitis B virus. Why? Because you are always in contact with blood and other body fluid samples of our clients. Yes, so those are the high-risk groups. The sexual commercial workers are also a high-risk group of contracting hepatitis B, also because of the nature of their work, and as I said, the drug addicts. So, why would the community be bothered if they are not among those whom I've called the high-risk groups? Us, the health workers, and all those other risky groups that I've mentioned, once we come from our places of work, we come back to the general community and interact with each and everyone. So the chances that we can carry hepatitis B virus diseases from our places of work, the hospitals, bring them home.
Yeah.
And also we bring them to the general community. That's why it is important that the whole of the community is aware about this disease and how they can protect and prevent themselves.
Okay.
Another mode of transmission that is very important for our viewers is that if I have a chronic hepatitis B virus, if I'm a woman and I'm pregnant, there are also chances of transmitting the virus to my unborn baby.
Okay.
And as you're going to see, is that when those babies get the infections, they can be affected more than us, the adults. So it is important that even mothers are screened when they are pregnant and they are advised accordingly on what they are supposed to do.
Okay. Okay. How would you get knowledge you have that disease? What are the symptoms?
Okay, thank you very much. Hepatitis B virus infection has two types. We have what we call the acute phase and the chronic phase. In the acute phase, we get general symptoms. General symptoms, the ones we are used to, you get headache, you get fever, you get general body weakness, muscle pains, joint pains, abdominal pains, sometimes vomiting and nausea. So that the cardinal symptoms of hepatitis B, meaning that may be difficult to tell when it has just presented because the symptoms are similar to all other infections.
Indeed.
As it progresses, as the liver starts getting damaged and breaking down red blood cells and other components of the liver, you start getting yellowing of the eyes. We call it jaundice in our medical language. Yellowing of the eyes or jaundice.
I'm sure people have just looked
So if you present to me in the hospital or in my clinic with those symptoms that I mentioned earlier, but while I examine you, I find out that even your eyes, this white part of the eye is turning to yellow, then I'm supposed to start thinking of a possibility of you having hepatitis B virus infection. So among the investigations that I'm going to request, if I was going to request for only malaria and typhoid, it is important that I also think of doing an hepatitis B test.
So physical examination is very important.
Physical examination is very important. Whenever you go to a hospital to see a doctor, after explaining your symptoms, make sure that the next step is to examine you according to what you have told him or her. So those are the cardinal symptoms. So at that stage, if for acute stage, if a person has hepatitis B virus infection, if I do the tests, we have a simple screening test we usually do. It's called hepatitis B surface antigen test. It is an easy and a very rapid test, such that you take off your sample and the lab technician will be in position to tell that that simple test is positive. And when they do that test, the story does not end there. It doesn't mean that you've been now confirmed an hepatitis B virus case, you are now ready to begin treatment and so on. When that test is positive, it means that this person has been exposed to the virus before. So they continue and do other investigations. Okay. Because when you get the virus, your body develops immunity against that virus. So when we are doing the test, we are checking the presence of that surface antigen, the presence of the virus in your serum or your blood. Also, we can also test the presence of the antibodies or the immunity against the virus, because whenever you get exposure to any particular infection, your body develops an immunity that is specific to that infection. So the presence of the immunity in your body, which is specific to a particular infection, is an indicator that your body has ever been exposed to that particular disease. And that science also helps us in making a diagnosis or in screening. So for the case of hepatitis B virus, once you have those symptoms and we test and we find that there's no presence of surface antigen or the presence of the virus, but you have the immunity against the virus, it indicates that you have ever been exposed to the virus. But the acute phase, you can get exposed and your body fights the virus, and you don't progress
to the chronic
stage. So there you are okay. However, if after 6 months of your first exposure, we test your body, we find that the surface antigens are still present, and also the immunity, or what we call the antibodies against that virus, are also still present. We do other tests, what we call the viral load, like the one they do for HIV. But now we are not doing HIV viral load, we are doing hepatitis B viral load to see how much virus is in your body. And if after 6 months all those tests are still positive, then you have progressed to a chronic phase, and you're a candidate for treatment. Yes, so the complications is after crossing to chronic phase, the virus still persists in your body, but also the symptoms are still present. And as the virus continues, it continues damaging the liver. And once it continues damaging the liver, even your clinical state keeps on changing, because we know the liver does so many functions.
Yes.
So once it has been damaged, it means that the function it was initially doing will be
jeopardized.
So as the virus remains in your body and the disease progresses, the liver continues to get damaged and damaged. So you go into one of the states of the liver called liver cirrhosis. The liver cirrhosis, it is not yet a cancer, but the liver is damaged to the extent that it no longer does its own function that it was initially doing. I can give like 2 examples. That liver helps us in the process of manufacturing of proteins within our bodies.
True.
So once those proteins are not being manufactured, it means that those proteins will not do their work. One thing us in our, we call it hemodynamics, the movement of blood and other body fluids between the tissues and the blood vessels. Once the proteins are reduced, it means that fluid will not be moving back from our tissues to the blood vessels to go and be cleaned and so on. And once that fluid remains in our body, we start swelling. We swell the abdomen, lower limb swelling, we get the feet start swelling.
The body malfunctions.
Yes, so once the body swells, it's an example of either the kidneys are not functioning well or the liver is not functioning well. So, meaning that in addition to the other symptoms that we saw, now this patient who is in a chronic phase will present with a swollen abdomen, lower limbs swollen, very yellow eyes, then with the other symptoms of headache, fever, general body pains, meaning that now the liver has been attacked so much. And when we progress from that stage, then the liver goes to another stage of liver cancer, meaning that the person will present with all the above symptoms that we have seen, swollen abdomen, but also with other symptoms, the general symptoms of cancer. We call them B symptoms. They may include excessive sweats at night, evening fevers, excessive loss of weight, in addition to lower limb swelling, yellowing of the eyes, abdominal swelling. You get, eh?
Yeah.
Yes.
Now, the doctor, basing on your previous explanation, hepatitis B is curable.
Yes.
But before we go, because most of Africans, they wait for something to happen and they look for solutions. But how do you prevent this? What are the countermeasures?
Yes, one of the objectives as to why we do these videos is to give information to our communities. And giving this information means that we are trying to help our community to prevent the problem before it happens, so that they are well informed about a particular problem or a particular disease, such that they can actually prevent it from occurring. As we have seen so far, I think some of the prevention measures have been mentioned. Why do I say so? When you tell people the risk factors, you are indirectly telling them that once you avoid those risk factors, you are preventing yourself from acquiring the disease. So there are 4 major issues here we can talk about. One, this is an immunizable disease. Let me start with the major one. This is an immunizable disease. An immunizable disease, it means that there are vaccines that have been tested and proved to work, that once you develop or you get that vaccine, you are protecting your body against acquiring that disease. So one of ways of preventing hepatitis B is vaccination. I know our people have had campaigns where they are calling people to go and screen and also vaccinate themselves against hepatitis B virus. And in some countries, it is a prerequisite for you to present proof that you've been immunized against hepatitis B virus before you are allowed to move in that country.
No dodging.
So those people who are traveling, in addition to yellow fever vaccine, hepatitis B vaccination is also one of the requirements that is needed
for you to go to
that country.
Okay.
So one of ways of preventing hepatitis B virus is through vaccination, getting an hepatitis B vaccine. There are,
at any age?
At any age. There are 3 doses given within 6 months. You get the first dose at 0, second dose after 1 month, and third dose after 6 months from the first dose. So you are supposed to complete that cycle of 3 doses of hepatitis B vaccination for you to be in position to say that now I have full coverage.
Okay.
That is 1. 2, we have what we call post-exposure prophylaxis. As we mentioned earlier that we have some risky groups like health workers. If, for example, I have not been immunized, I have not been vaccinated, and I'm on my ward doing my ward rounds, all of a sudden blood splashes into my eyes, or I get into contact with the blood and I'm very sure that that person tested for hepatitis B virus positive, we do what we call post-exposure prophylaxis, just like for HIV.
Okay. It has hours, the duration, right?
Yes, so you go and get that treatment to prevent yourself from acquiring the virus. But we are encouraging the health workers not to wait for that time, since there is a vaccine.
Yeah, true.
So the vaccination programs, most of the countries, they target the risky groups first. Medical students, nursing students, and then health workers to get the vaccines first. However, that very vaccine has been incorporated into our routine immunization for our children. That is from around 2002.
Just like polio?
Yes, it's part of the package for our routine immunization. Therefore, we encourage mothers to take their children for the routine immunization because hepatitis B virus is one of the diseases that is targeted within that package.
Okay.
So we have surfaced in 2 ways of prevention: vaccination and also the post-exposure prophylaxis. So other ways of preventing is to prevent yourself from getting exposure of those risk factors that we talked about. If you're a drug addict who is using injectables, make sure that you either stop the act or you use safe methods. Don't share needles. Yes. Then limiting the number of sexual partners or using protection.
Okay.
Yes, and lastly, for the general community, is to know your status, to go and screen for hepatitis B and also get vaccinated. These services are offered at all our medical facilities, as we mentioned earlier.
Yes.
Those who are around here in Kaboja, they can come at our health facility, IFNL's campus. They screen for hepatitis B. Those who are in town, they can go to our King Fahd Plaza Clinic.
Kampa Road.
Yes, and those in Imbale, we are already screening and vaccinating. About vaccination, I'm not sure about the Wakiso and Napala district, but those in Imbale, we do screen and we do vaccination at our IU Health Center for free.
Thank you for reaching the great heights.
Yes.
And we appreciate your conclusion, Doctor.
Now, with that information that has been shared to the community, I would like to encourage our viewers to try and find out their status of hepatitis B virus, and also those who can afford to do vaccination of the same. To our pregnant mothers, they carry a higher risk to spread the virus to our unborn babies. And the unborn babies, once they contract hepatitis B virus, they have between 90 to 95 chances of progressing to the chronic stage compared to adults.
Which is very
For
bad.
adults, they have a 5 to 10% to progress from acute phase to chronic phase. But if the babies get the virus, they have higher chances of progressing to the chronic phase. And that puts them at a risk of developing liver cancer later in the future in their lives. And that's some of the reasons why people are asking questions like, previously cancer used to be the disease of old people, but nowadays you get a 25-year-old with a cancer, a 30-year-old with a cancer. These are some of the reasons that these babies get exposed to the risk factors that bring cancer. So 25 years later in life, I think it is a reasonable number of years for that cancer which you acquired when you are still young to expose itself.
Okay.
So let us do the vaccination and the screening, and also take the children for immunization and vaccination. We thank you very much.
Okay, thank you so much, Doctor. We are still admitting students, so come for admission for any course. Secure your future by securing an immunization
package
for hepatitis B. You won't say we didn't tell you. Forewarned is what? Foretold, if I'm right. The one on camera is MC Pilar. My name is Baligia Fanafan. Bye.